Hi, my name's Emily Walker. I'm a cancer epidemiologist working with the Brain Tumor Registry of Canada. And today I'm going to give an overview of some of our most recent reports and some upcoming work that we have. So just to start, what is the Brain Tumor Registry of Canada? The first really important point is that it isn't actually a standalone registry. It's more of a surveillance research collaborative. So we are a group of researchers that include neuro-oncologists, epidemiologists, biostatisticians who collaborate with Canadian cancer registries to improve the capture of brain tumors in the cancer registry in Canada. So Canada has a really good cancer registry system. It's a passive surveillance system where people are added to provincial and territorial cancer registries when they're diagnosed with or treated for cancer. And each provincial registry is mandated to collect information on the frequency of cancers within their respective geographic regions. And they submit that information to Statistics Canada to compile in the Canadian Cancer Registry. Brain tumors are a little bit unique, and the reason for that is that cancer registries are mandated to collect information on non-malignant behaviors, whereas for most other cancer types, it's only malignant. The problem with that, however, is that non-malignant tumors are diagnosed and managed in ways that are inconsistent with the typical pathways through which cancer registries receive data. So there are some barriers there. And part of the project is really aimed at identifying what those barriers are and finding a way to get through them. So how can we make sure that cancer registries are receiving the data that they need to fully capture information on the frequency of non-malignant brain tumors in Canada? So that's a major part of this project. Another really important thing is that brain tumors are a very heterogeneous group of tumors. So there's many different histologies and they affect people in very many different ways. Typically in Canada, we have cancer surveillance reports that combine all brain tumors into one category based on the site, central nervous system. And that's of really limited utility to the neuro-oncology community, who really need to understand the frequency of specific histologies so that they can understand what the risk of brain tumors are and the prognosis for people who are diagnosed with those tumors. So another really key component of this work is to provide those really comprehensive pan-Canadian surveillance reports that go into the kind of nitty-gritty details of different histologies and how often they're diagnosed amongst Canadians and what those the prognosis is. So that is a quick overview of this project and what we do. And we have a couple of recent surveillance reports that I will summarize for you now. So to start, we have the incidence and mortality report. And incidence is a measure of how often people are being diagnosed with a brain tumor in Canada. And mortality is a measure of how often people are dying from or with a brain tumor. And these are all based on the time period of 2013 to 2017, which is up to the most recent information that's available in the Canadian Cancer Registry. And so this is the cover of the report here, and I've put the link at the bottom. So please go in and check out the full report. There's a lot of good detail in there. So to start, I guess I'll just preface this with saying this is information for all of Canada except for Quebec, because we do not have information on cancer diagnoses from Quebec occurring in Quebec for this time period. So overall, the annual average age standardized incidence rate for all primary CNS tumors amongst Canadians was 21 people per 100,000. So for every 100,000 people in Canada, about 21 were diagnosed with a brain tumor during that time period. And tumors of the neuroepithelial tissue were the most common, accounting for 33.6% of all CNS tumors and 83.2% of malignant tumors. And tumors of the meninges were the second most common tumor and most common non-malignant tumor. So they made up 25% of the total number of CNS tumor diagnoses and 39% of non-malignant tumors. So we took a look also at how the age standardized incidence rate was trending over time. And during this time period, we noticed a slight decrease in the frequency of new diagnoses over time for most histologies except for glioblastoma, which actually had a slight increase over time of about 0.7% per year. So just flagging that in case that inspires somebody who's watching to investigate that a little bit further. The incidence of CNS tumors overall was pretty much the same between males and females. Again, we would expect about 21 diagnoses per 100,000 of either males or females. However, there was some slight variation by histology. So men had slightly higher rates of neuroepithelial tissue tumors, and females had higher rates for tumors of the meninges. Looking at the incidence by age, we saw an increase in incidence with increasing age. And we had about, for every 100,000 children, about 5 new diagnoses of CNS tumors versus 35 new diagnoses per 100,000 adults. So quite a big increase there. And looking at the geographic distribution of tumors. So on the left here, we have malignant tumors in blue, and on the right, we have non-malignant tumors in green. And the frequency of non-malignant tumors was about 1.7 times higher than that of malignant tumors. You can see here along the bottom that the scale for the malignant tumors is much tighter. So the difference across provinces is fairly narrow. The territories look really light here, but I would caution that there's very small numbers up there, so lower confidence in those estimates. But generally speaking, there's not much variation across provinces in terms of the incidence of malignant tumors. Conversely, we see a much higher range in the incidence of non-malignant tumors. So I just want to spend a little bit more time talking about that, because we can notice right away that Ontario is quite a bit darker than the other provinces, which is associated with or indicates a higher incidence rate. So as I mentioned previously, non-malignant tumors are harder to capture in cancer registries. So the data just aren't getting to cancer registries for most provinces. So we have a sense of how many tumors we're expecting by looking at the US. So the US has been collecting these tumors for longer in their cancer registries, and so they have more complete information on the frequency. And because we know that between Canada and the US, we have similar frequencies of brain tumors overall, we can use the frequencies in the US to estimate how many we're expecting in Canada. And when we do that and compare what we see in the cancer registries to what we're expecting based on rates in the US, we can see that Ontario is actually a lot closer to the expected rate than other provinces. So what we interpret this pattern as showing us is that Ontario is actually closer to complete, and the other provinces and territories have a little bit more work to do. So again, that's what we are, part of what we're trying to do here with this project is to work with individual provinces to identify specific strategies that would work for them to help get their case capture up. But just want to flag that again, this does not indicate that the risk of non-malignant tumors is actually higher amongst people from Ontario. They just are capturing those tumors a little bit better in the registry. Okay. So moving on to the most recent report, it was just published in June, is the Pan-Canadian Survival and Prevalence Report. So again, just a couple slightly different measures that give us a well-rounded picture of what's going on with brain tumors in Canada. So starting out with some survival estimates, as is likely expected, the net survival is higher for non-malignant CNS tumors relative to malignant behaviors, quite a bit higher. But there was a lot of variation by histology, and even within malignant tumors, a lot of variation by histology. So there's 8 malignant histologies that are associated with a median survival that's more than 8 years. And then also all but 1 non-malignant histologies had median survival more than 8 years, including meningioma, which is the most common non-malignant tumor. But conversely, for malignant tumors, median survival was much shorter for some histologies, most notably glioblastoma with a median survival of 8 months, followed by lymphoma with a median survival of 12 months. And these estimates are consistent with what we found previously in other reports and also with estimates from other jurisdictions. So we're fairly on par with other places in terms of survival for these tumors. Younger age in general is associated with longer survival time. However, interestingly, the adolescent and young adult age category actually did have longest survival time for a subset of histologies, including glioblastoma, anaplastic astrocytoma, malignant ependymoma, and malignant glioma not otherwise specified. And because those are some of the biggest categories of histology, that kind of pulled their line up a little bit there in this curve. And moving on to prevalence. So prevalence is a measure of how many people are living with a CNS tumor at a given time. So it incorporates how many people are being diagnosed and how long they live on average, and gives us a sense of the actual burden of CNS tumors in Canada. So at the index date of January 1st, 2018, there are an estimated 37,575 patients living with a primary CNS tumor in Canada. And of these, 80.4% were non-malignant, which is expected based on the survival time for non-malignant tumors relative to malignant tumors. And in these graphs here, we have the most prevalent histologies by behavior and by sex. So for malignant tumors, glioblastoma is the most prevalent. It's the most frequently diagnosed, and it is higher prevalence in males relative to females. And for non-malignant tumors, meningioma is also the most prevalent. So, which is expected, again, based on the high incidence of meningioma and the long survival time. And it is most prevalent amongst females. Okay, so moving on from the surveillance reports, we've also recently published a paper on brain mets, and it is an open access paper. I've put the citation down here. You can go check it out at Current Oncology for more details. But just some background on brain mets or metastases in general. So in cancer registries, we do collect information on the occurrence of metastases at the time of a primary tumor diagnosis. So if somebody is diagnosed with a primary tumor and concurrent to that they have a metastasis, we would have that information in the registry. We do not, however, have information on the occurrence of metastases post-diagnosis, so over the disease course of people with cancer. So we approach this in two ways. One, we looked at the Canadian Cancer Registry to see, concurrent with the primary tumor diagnosis, how many people were also diagnosed with a brain met at that time. And then second, we did a systematic review of the literature to identify the expected lifetime frequency of brain mets for people who are diagnosed with different primary tumors, and use that to estimate for this cohort of patients diagnosed with cancer between 2010 and 2017, how many of them are we expecting to develop a brain met over the course of their disease. So starting with concurrent diagnoses, there are an estimated 25,000 brain mets diagnosed concurrent with primary tumor diagnoses from 2010 to 2017. And that comes to an annual average of 3135 diagnoses. So in the graph, or sorry, in the map here, we see the annual average number of brain mets at primary tumor diagnosis by province. And we can see that about 64% of those occur in Ontario and Quebec, which is just reflecting the population size in those provinces. And based on the expected lifetime incidence of brain mets and the number of cancer patients that were diagnosed in Canada from 2010 to 2017, we're expecting more than 80,000 brain mets over the life course of that cohort of patients. So as you can see from these numbers, brain mets are much more common than primary brain tumors in Canada. And interestingly, of brain mets that were diagnosed concurrent with the primary tumor, 88% originated from only 6 sites. And the biggest piece of this pie here is by far lung. So predominantly, if somebody is diagnosed with a brain met at the time of their primary tumor diagnosis, their primary tumor is in the lung. So those are just kind of quick highlights from that paper. There's a lot more in there. Please go check it out. As I said, it's open access through Current Oncology. And finally, I just wanted to talk about a dashboard that's coming soon. So we are developing a dashboard, an interactive dashboard to look at the surveillance estimates that we produce. We will update it with new estimates as we produce new reports, and you'll be able to go there and take a look at some breakdowns and some visualization. So just a quick overview, it will have many tabs, as you can see at the top here, going through incidence and incidence by age, sex, behavior, survival, and prevalence. And on all of the pages, you'll have an opportunity to look at a drop-down menu to select specific major histology groupings or specific histologies, and you can select one or many and different behaviors, and it will repopulate the visualization with the appropriate estimates. So that's for incidence. An example, just looking at incidence of glioblastoma across provinces here. And here's an example for survival. So again, here I've selected some histologies, and then the graphs are populated with the survival estimates for those histologies, looking at by age and by sex. And you can also hover over the nodes in each of the graphs, and it'll give you the specific estimates for that category. So thank you very much for listening to my talk. I hope that you found some interesting information and it's inspired you to go take a look at the full reports. If you have any questions about the registry or any of the work that we do, please feel free to reach out to the Brain Tumour Foundation of Canada, and we will get the message through them. Thanks.